How's everybody doing? Good. All right. Thanks so much for coming. This is the final session of our series. Thank you. And we're this session we're going to do very differently than the way we did it last year. Last year it was more of me droning on about stuff. Today, I figured you probably heard enough of me talking. We'll get a bunch of people who have different areas of expertise in the child welfare system, and we're gonna kind of do this as more of a Q&A. So I'll introduce everyone else on the panel, and then if each of you want to just add a little bit more about yourself besides my brief introduction, because I'm sure I'm gonna miss things. So just before we get into that, just remember the ground rules. So no questions about specific kids and their treatment plans, no specific questions about any professionals' treatment plans or things like that. Hypotheticals are okay. And an extra kind of rule for today, you may direct questions at specific panelists if your question falls into a particular area. I'm gonna welcome anybody on the panel to jump in if they have thoughts, because, while each member of this panel has kind of their feet in different areas of child welfare, some of these things overlap, and it's good to get a discussion going. So, unfortunately, Joel Russell couldn't be with us today, so he's not gonna be part of the panel, but everybody else is here. So I will just go down the line to my right, and we'll start with Carly Height, who is an attorney with Legal Aid. And in particular, she works a lot with school litigation, but because that overlaps a lot with kids in the child welfare system, she often is involved with cases involving kids in that field. So Carly, anything else that you want to add?
I'll just add, so I work within the Attorneys for the Child unit at the Legal Aid Bureau. So the attorney for the child is the representative specifically for the child who's involved in the child welfare case. But I don't appear in family court that often. I get brought in to help on educational issues. So I will do my best if you have questions about the law of child welfare. But my wheelhouse really is special education litigation, school suspensions, unfortunately, so it's more in the school realm than the direct child welfare realm.
And then next we have Leah Daniel, who is the founder of Fostering Greatness. And she's also, I think, founded a couple of other organizations throughout her career that have, with the goal of kind of helping kids who are transitioning out of the foster care system, helping them find supports and resources so they can kind of land on their feet and kind of blossom into whatever their young adult lives are going to look like.
Yeah. So thank you. I have worked in just about every facet of foster care. I am an alumni of foster care, and meaning that I grew up in the foster care system. I was in foster care for 10 years from the age of 11 until 21. If you had ever asked me if I would be working in this field today at the age of 15, I would have told you not a chance in France. But the work just kept calling me, and so I ended up becoming a kinship foster parent with my younger brothers, and I ended up at the age of 23. So I ended up advocating for them in the mental health area, and just different facets for other youth and young adults. Through that also, I noticed that there were a lack of resources for foster care youth, young adults, and alumni who are transitioning out of the foster care system. And it's a slogan that they use: once you're grown, you're on your own. But really knowing what we know about trauma and the makeup of the adolescent brain, knowing that most of them, although they may be the age of 18 through 21, some of them do not serve in that capacity. So they need extra services, and that's where Fostering Greatness was founded. We do a lot of programmatic things as far as assisting youth, young adults, and alumni. We do not have an age bracket because there's a lot of young people who need assistance. And so we just help where needed. And right now we're working on policy with housing. because there are a lot of areas where things are gray, and these youth and young adults and alumni are homeless. And when you're in a state of survival mode, you can just about do anything. And so we want to change that narrative and turn a negative situation into a positive outcome. So that's why I'm here, to just talk about the opportunities that are available, not only for foster care youth, young adults, and alumni, but for those who support them and those who come in contact with them often.
Thank you, Leah. Next, we have Maggie Dreyer, who is a trauma therapist. She has her own private practice. She does some work teaching at Damon College, and kind of has her wheelhouse is working with kids and families with complex trauma, which of course includes so many kids in the child welfare system.
Absolutely. I have a lot of experience in child welfare. I developed GA Family Services, their whole entire foster care program. Worked there for 10 years prior to going to Damon College. I have 30 years of experience in treating children who have experienced complex trauma. And I'm also a foster parent who adopted 2 teenagers from foster care into our family.
And then finally, we have Hannah Holden, who was previously worked with the Department of Social Services and is now with Jewish Family Services. She's also a foster parent, so can bring some knowledge from that realm and also a systems realm.
Yeah, so I actually just finished, graduated last weekend with my master's in social work with a specialization in child welfare as well.
Congratulations.
Yes.
So I feel very humbled to be on this panel with such distinguished people, but I hope I can bring my perspective as someone who up until a month ago worked within the child welfare system at the Department of Social Services and really tried to improve the experiences of the system-involved families that we serve. As a foster parent, my commitment was to reunification and really trying to support families in reunifying with their children. And whenever that's possible, I think it's great for everyone involved. And so that's my own personal perspective on being a foster parent, and it's something that I don't always see that we give our families that we work with the support that they need in order to overcome whatever has caused that disruption in their family system. So that's why I went to school to study social work and see what kind of improvements we could make in our supports to families and in our system and of service to families to try to help them overcome the barriers that they have. So anyway, I'm talking a lot, so I'm gonna stop, but I just really feel honored to be able to sit up here and get to know all of you.
All right, so again, thanks again to everybody for joining us. We had one pre-submitted question which we'll start with, but just, keep in mind, we talked the last 3 weeks about, normal attachment process, disruptions to that. We talked a lot about the mental health sphere in terms of diagnoses with these kids and treatment methods, and we talked a lot about systems navigation. So those are all, if there was anything that kind of remained unanswered from those 3 sessions, or if any of you thought of new questions since we finished those are obviously fair game, but any other questions are welcome, because we just want this to be a useful discussion for the next hour or so. But we had a question submitted over the last week that asked, if the panel could kind of expand upon the understanding of the 1522 rule, which, just as a reminder, states that if a child is in foster care for 15 months out of a 22-month period, there is a requirement that the legal system has to move forward with termination of parental rights, at least the legal process. It doesn't mean that ends up happening, but that process must be started. While I'm familiar with the rule, I will admit I'm not the best expert to talk about it because I don't often end up in a courtroom where this comes up. So, I thought, Carly, you could talk about it a little bit, and then of course, if anyone else wants to jump in with their experience, you're welcome to.
Okay, so I have my cheat sheet because unfortunately I'm not the expert either. I'm not in family court a lot, but so I think the first answer to this question is going off of what Hannah was saying, that the goal is always, under, the federal legislation, the state legislation, reunification. So starting from the premise that reunification is the goal, if a child is outside of their parental home for 15 out of 22 months, doesn't have to be consecutive, then DSS has to file a petition with the family court to terminate parental rights. The petition will then be evaluated by the family court judge, but as the question suggests, it could be challenged on the grounds that the department has not made reasonable efforts. That challenge could come from the parent's attorney, and it likely would. It also could come from my department. It could come from the attorney for the child if the child is also would prefer reunification. And I don't know if this was covered, but in New York State, we have an attorney for the child model. We don't have a law guardian model. Under the law guardian model, which used to exist in New York and still exists in several other states, it was a best interest standard, and so the attorney could really kind of decide what they thought was best for the child. But in New York State, it's an attorney for the child model, and so the child's voice has to be brought into court, and there's actually a whole standard for an attorney to override what the child wants. And so the attorney could challenge on best interest grounds that the department has not done what it needs to support reunification. So what might that look like? Starting from the premise that this is, about the, most extreme thing that you might take away from a parent is their child. The department has an obligation to help them access housing, income, mental health and substance abuse supports, transportation, parenting skills, school, special education, that's where I might come in. And so if the department has identified the menu and not been able to come forward with one of the services on the menu for the parent, then that could be grounds for challenging it. If the department has identified that the child's not going to school because they don't have a school placement, well, of course, that could be grounds for challenging it. And there was the question about, well, is it going to be evidence that the child is doing better out of the home? That could go to the question of what type of abuse and neglect was happening in the home. If a child is doing better in another setting, that might be evidence of the degree of abuse and neglect that was happening out of the home. But it's not going to per se indicate that the child should stay in that foster placement or that parental rights should be terminated. Because, kind of thinking through it, well, if it was because the child wasn't in the right school, then presumably the child might do better upon reunification. Or if it's because housing was inadequate and now the menu has been followed and followed up on, then the evidence that the child's doing better out of the home might not really speak to whether they would do better upon reunification. Yeah, so my supervisor was just wanted to make sure I stress the trend is against removal, the trend is toward reunification. That really is the presumption under the law. And the challenge against reasonable efforts could really come from multiple places, including the child, really. Their attorney can challenge it, and you might expect the parent to challenge it.
So, and Carly, I think one interesting point that you brought up is that different states can have different models. In the realm of what we had talked about last week, the pendulum of like where reunification falls in terms of the goals has swung a number of different ways over the years, and it's different in each state because much of the child welfare system does not fall under direct federal legislation. It filters down to states, and then it can even go locally. So you have different states with different models, and that's why it's important to have some knowledge about, the legal, the model that each state uses, because it can look different. This is a very good example of that. So any other thoughts or questions related to that, or any other comments from?
Is everyone here foster parents from the county or from different agencies?
One with the
County agency.
So it changes, so agencies are sometimes the ones that have to prove diligence, similar to what Carly was speaking to. And the county will contract with us, the agencies, to be the ones to ensure that that court menu is being followed. So sometimes the rules even differ depending on what agency you're with, and they definitely differ county to county. So I know that could be frustrating for the 15 to 22 rule. It is it all means the same thing, but each agency and each county may go about that a little bit differently.
Each caseworker may go about
Each
that.
caseworker may
Yeah,
go
so
about that.
you as a foster parent may be aware of the 50 out of 22-month rule, and 15 months is ticking away, and you're thinking, okay, they're gonna file a TPR, and no TPR is filed, and you're wondering why it's not happening, because in your foster parent training, you were taught after 15 months, the child is in your care, or out of home care, there's gonna be a TPR filed, or then the TPR is filed, but the judge doesn't act on it. So these things they're in law, in their guidelines, but they're not set in stone.
Which
Every
can get
case is
very
different.
frustrating,
Oh,
right?
yes,
Can
yes.
I ask you, just cause it's a rule of thumb with us when we train
Yeah.
and speak, what is TPR?
Oh, sorry,
Yes,
termination of parental rights.
Thank you.
It's a petition that the department will file, one of the lawyers in the department will file because it's required or because they think it's the right thing to do.
So now do the parents have, they'll complete their menu, I would say, within that same 15 to 22 months?
That's generally the expectation. At remand, they're getting that core
The
menu.
menu is kind of the list of things that has been come up with that would support reunification. So it could be a parenting class, it could be get the kid vaccinated, it could be a whole list of things.
Are there ever situations where TPR gets filed like 12 months in? Because I was told they would probably get
Yeah.
12 months for my situation. Okay.
Any other questions related to that initial question? Does anyone else have any other questions that you guys would like to ask of our esteemed panel?
I don't have so much a question, but we are in a situation where, because of some situations in the family, we may end up with 4 nieces and nephews staying with us. So remember our faces, because I can see situations already where we might need everybody up there. Really good information, there's a lot we have to learn.
And I would add to that the 15 out of 22 months does not apply to kinship placements.
That's really good to know.
Yeah, a lot of people don't realize, I didn't know that for a long time as a foster parent. I never had a kinship placement, but as a provider of services, that's a key learning. So there's not as much of a timeline on kinship placements.
Meaning that it's, that parental rights are held more or less.
It's that the kinship placements are considered to not be as time bound by the courts, so it's almost as if because the children are with a relative, that the parents have a little bit more flexibility and time to, deal with whatever the issues were that caused the children to be removed. Just something to be aware of.
Any other questions or thoughts from anything we talked about the last 3 weeks?
Well, with me, I think I'm still trying to get a grasp on, the different attachments,
Mm-hmm.
yeah.
The different attachment styles?
Yeah,
Yeah.
yeah.
Anything specific that comes to mind when you think about that?
No, I just really should have been taking a lot of notes on
Mm-hmm.
maybe the definitions of kind of each one.
Okay.
Yeah.
I guess, one question I'll pose to everybody is, if you have had experience, if you can kind of talk about experiences working with kids with either non-secure attachments or disorganized attachments, and just perhaps just how your general observations of those kids in their interactions with parents or their caregivers, just what that looked like to you guys.
So I'll go. I was 23 years old when I gained custody of one of my siblings, my younger brother. He had been adopted twice and given back twice. He had been in a mental institution, and he was only 12 years old. His father was killed in 2005, and when he was taken from our mother, so we all went in different intervals.
Okay.
So me and my sister first, and then my middle brother, and then the 2 younger brothers. So everyone was, taken at different times. And he was the most attached. He was the second to last baby. And when he was taken from school. So imagine just like a 3-year-old child who's attached to their parent, and someone who they do not know comes to pick them up. And so he began to act out. And so he was legally blind also. So it's like when you think of an extreme case, this was an extreme case. He had been through a traumatic situation. When he was 1, he was burned by hot water when he was at his father's girlfriend's house. So he had been through a lot. And so when we think about some of the traumatic experiences that he has had, and then how his behavior mirrored that, you could understand, right? But if you didn't have the background of what happened, you're like, why is this little boy acting out? So when I received custody of him, he had Oedipus complex. And I'm not sure if anybody knows what that is, but it's when the male in the home attaches to the dominant female, and they tell you that you cannot have smaller children there because it is like a threat. I did not know this. No one made me aware of this. 23 years old, getting my 12-year-old brother, and just thinking naively, if I just love him, give him structure and everything that he needs, he has a secure place, everything will be okay. And that was far from the truth. He is an adult now, and what he has said to me is, thank you, Leah, for doing everything you did. You really worked hard with me, but I just wanted my mom and dad.
Yeah.
And so what do you say to a youth who just wants their mom and dad?
Right.
And they can't have their mom and dad? So I like to think about realistic situations, because you're here in a training, but every situation is different. You know, you really have to think about stuff that you've learned in the training and see if it fits to your way of doing things in your home. My brother, he acted out every day at school. He was angry, and I would tell him, you have every right to be angry, but as a young black male, this is unacceptable. You can't act out like this. You know, you're gonna be suspended from every school you go to, and then what? So I would have him write about his feelings. Write about why you cursed the teacher out today, why you're feeling this specific type of way. And so now he's a great writer, and he talks about that. I used to make him write till his hand fell asleep, you know. So, but being proactive, because I wanted him to think about these things, because we can all have emotions and all have feelings. So when I think about those things, and I think about the makeup of the adolescent brain and what happens when youth go through trauma and how they regress, you know, and there's certain ages, and we're thinking that they're supposed to be able to do all of these things, and we as adults sometimes can't even express our feelings or act the way we should act when we feel a certain way. And so when you're thinking about these youth or young adults that come into your home and all they've had to experience, it's gonna be a learning. It's gonna be a learning cycle for you, but talk to them. You know, the more you talk, you begin to understand, and when you understand, you have grace. Not that you let things just pass on or let them do what they want to do, but you begin to understand, and it develops a relationship between you and that child or that young adult. And you begin to understand, you say, well, I would say, if I had gone through all that, how would I act? How would I behave? And so I started just doing more proactive things with him. But ultimately, when he became 16 and 17, he wanted to choose his own things to do. So again, that's where they have choice. You know, it's not that you do everything you can do. Get them all the services that they need. The issue with my brother was that the social worker did not explain everything that was going on with him. And I didn't know until I went to adopt him, and they started naming off all of the disorders. And I'm like, what is that? What is that? What, you know?
And.
Right. And so he's young. He's like, I don't want to go to therapy. I want to be like everybody else. I don't want to have to do. So you go against those different things. And these are real life situations where kids don't want to be different. They don't want to tell people they're in foster care because it's an embarrassment to them. I mean, because other kids are cruel, you know? So just thinking about those disorders and just things they've gone through. So really just doing the research, following up, talking to them, and really just trying to be understanding. you know, and think about, so I always tell people, think about when you were an adolescent and some of the things you used to do. Would that be considered a disorder? You know, so
Right.
some of those
Yeah.
things and what they're dealing with now, it's a different world, you know, that they're growing up in. So just being mindful and talking to them, because my brother, he said, you did everything you could do. It was my choice, but he remembers. And so that's the thing I want you all to take with you. Still do the work. Get them the counseling or the psychiatric therapy that they need. Get them, you know, and some people are against medicine. I am not. If it's needed, it's needed, you know, but give them what they need so that they can thrive later on in life. You know, you may not see it in the beginning, but know that they will remember. They'll know that you stood your ground for them and with them and advocated for them. And again, just remember what they've gone through, because that means a lot to them when people remember and they advocate for them and they show them that, you know, that you're gonna be there, because all they need is consistent adults in their life. What's consistent, not somebody to degrade them or tell them everything that's wrong with their life or what they've done, but a consistent adult that sees the things in them that they don't see in themselves, sees the things in them that they always need the reminder about because they got a lot of things going on mentally. So I just wanted to share that because that was my experience. That's what really got me to doing the work, helping those who are like my brother. But I would always tell him, you gotta do the work too. I can't do everything for you. You gotta do the work. You know, and so now even as an adult, he didn't choose the life that I would have preferred him to choose, but he remembers everything that I did for him. He remembers, and it's in the back of his mind. So when he does decide to do better, he has that toolkit already there for him.
And kind of tying that to, if you guys recall the strange situation videos we watched that first week, you know, one of the things that Lee, I think that you talked about a lot with your brother was you guys worked on his ability to kind of self-reflect and tap into his own feelings,
Yes.
right? Now, when babies are going through some of the life experiences that they go through, if they end up in the foster care system and they kind of learn that fundamental rule that the world isn't safe,
Yeah.
what comes with that is they learn that feelings aren't safe.
Mm-hmm.
So now that looks like a lot of different things, but if you recall when we watched the video of the toddler with a secure attachment, it wasn't that there was no feelings there. You know, the toddler was distraught when mom left and, you know, the stranger couldn't console them. But that child was able to experience what she was feeling because she has that home base, that emotional home base. So, and the kids that had non-secure attachments, you saw one that was, you know, whose emotions were just uncontrolled, just constant, high level, intense emotion, and another one that was showing nothing, no matter who was in the room.
Yeah.
And this is why the attachment piece gets so confusing, because those two opposite pictures come from the same space. And you can see variations of the two, especially in disorganized attachments, because that doesn't follow a template. But with the idea of being consistent and available, one of the things that does for kids is it allows them not just to understand that the world is safe, but feelings are safe. Like it's okay to feel angry, irritated, frustrated, sad, all of those things. It's okay to feel those.
It's normal.
And it's normal to feel those. Thank you, yes. And as kids slowly get more comfortable with that concept, that's what can make a big difference for helping them to regulate as they get older.
Yes.
The other thing I'll point out is that there is, so like the Oedipus complex involves a male child and a female caregiver, but the reverse can happen too, and that's called the Electra complex. So when you have a female child and a male caregiver, the same dynamic can happen. So it goes both ways, but if you ever see the Electra complex come up, that's what that's from. So they're both based from Greek mythology, which I used to be really into when I was a kid. That was my thing. Any other thoughts kind of related to experiences with different
Can I
attachments?
just
Oh, yes.
piggyback on what Lee said? I'm the director of Child and Family Services and Mental Health Advocates of Western New York. And one of the things I would like to piggyback on what you said is also being the people that help remind the rest of the world that this kiddo has been through trauma. Because it amazes me how people don't look at that. They just don't look at it at all. And they're like, well, he's just lazy and he doesn't wanna go to school. I mean, that's just like the constant, that's 90% of our kids that we work with right now. So it's just that reminding people, you know, not as an excuse, but as a, let's think about this, let's look at what this background is coming from. Because people, you know, and I sort of go towards schools, that, but it doesn't happen. People don't see it, they forget that this, that, you know, what this child's been through.
Right.
Are you gonna share our experience?
You know, there's so much going on in terms of how we approach that and from a therapy perspective. And often people will say to me, you know, why are we not addressing the therapy? Why are we not addressing the trauma in therapy? And really, we're maintaining safety. We're doing emotional regulation. We're doing feeling identification first. And then we want to make sure that the environment is going to support the intense trauma work, right? So if it's a temporary placement, or we know that it's not a long-term placement, I mean, it's sometimes 8 to 12 months before we're going to start doing the trauma work. But we are strong advocates as well, and I'd have to say, absolutely, with school systems, we're making phone calls and reminding teachers and teachers' aides and the CSE committees, you know, ask yourself, you know, not what's wrong with this child, but what happened to this child.
Yes.
And use that trauma-informed perspective and teach them. You think by now, I mean, it was such the catchphrase for almost 10 years, but so many school systems are not approaching it that way. And so many diagnoses are coming with these children, but we take a step back to confirm that that's the actual criteria to meet the diagnosis with consultation often with Dr. Russell to say, you know, this is trauma, and we got ADHD, we got post-traumatic stress, we got so much related to trauma. So let's really look at that first, and attachment's such a huge part of that as well. So my mind is in a million places.
I'm so glad you said that, because that's so important to really look at kids' behaviors and not try to label them, but to really look at what's happening and how much of their behavior is a response to what they've been through.
And I say to everyone, every behavior is a need. Let's figure out what that need is.
Right.
Every behavior is a need. What is the need?
Yes.
And it's a consistent conversation, you know, it's not just a one-time thing. Let me learn this trauma-informed care and then that's it, because kids are gonna get on your nerves. You know, all types of things are gonna happen. You're gonna know why they're acting out like that. And I just, you know, a couple of years ago, I was an English teacher, and I was in one school, and I was subbing for another teacher, and I was pregnant at the time, so I was super emotional. But this one little boy, we were in a 611 class, and he came in, you could tell his uniform was dirty, that no one woke up with him that morning. He had a slob mark on his face, so nobody washed his face. And he had these little mouthwash cups. You know how kids have little mouthwash cups, and he kept going to the water fountain, and he was disrupting the class. And the other teacher that was in the class, I'm gonna write him up. I said, can I talk to him first? You know, and so I said, you know, what's going on? What's happening here? And he was like, Miss, I just want to get some water from the water. And I said, okay, you can get some water, but you don't have to keep going back. He said, Miss, today is my birthday. And I said, it's your birthday? Oh my goodness. I said, okay, so listen, the other teacher in here has to teach. What is it gonna take for you to sit down and listen? He said, can you get me a Big Mac? So a couple of things popped up. Again, the neglect. This child got up this morning, uniform dirty, slob on his head. Nobody got up to supervise or love on him that morning. Then it's his birthday.
And he was hungry.
Right. Everybody loves to be, you know, honored on their birthday, and then he was hungry. I know that I can't function if I'm hungry. So all he wanted was a Big Mac, and I went out on my break and got him a Big Mac. So after that, he always remembered me as the lady who got him some food and say, well, what are we eating today? But the point was, the other teacher didn't take the time, because she was so annoyed with his behavior, to really see what the root issue was. And when I got him that Big Mac, you know, he calmed down the rest of that day. But I think about, if I'm hungry, I'm hangry, you know, haven't gotten any sleep, you know, you just never really know what these youth are going through and their environment and their situation, and just because they're placed somewhere else, like even with my brother, even though he was in a safe, stable environment, he was still hoarding food, and I'm like, why are you hoarding food? We don't have any locks on the refrigerator. Like, why are you doing these things? But because it's there, when they talk about nature and nurture and your lived experience, we're asking these young people who have lived this life for whatever particular amount of time, and just because they come into our home, that they're supposed to automatically change. It doesn't work that way. And so we have to be realistic about these situations, and especially if they have disorders. They don't know. They're growing up into adolescence. They're already going through different changes and things. And then on top of that, all of these adverse trauma experiences, and they don't know. So we have to have these conversations, support each other, because it's not easy. I tell you, when I had my brother for 6 years, it was like going through the twilight zone. Some things I can't even remember because I was just exhausted and I did not have any help. And that was my first experience.
At 23.
At 23. Coming from California from my good job to come get my brother. Because I just was, trying to save everybody. And people ask me would I have made the same decision. I love my siblings and I'm the oldest. And knowing what he went through, I just wanted him to have a chance. The same chance that was given to me, and so I wouldn't change it. And I've learned so much. And I've helped others through what I've learned. So just thinking that, have the conversation with each other. Just because this class ends doesn't mean that you can't contact any of the people here, and you need support. When you guys get your nieces and nephews, you're gonna need support.
Oh, we did it anyway.
Yeah, you're gonna need support, because it's gonna be some good days and it's gonna be some not so good days. But knowing that you're that support for them, because they could go anywhere else, but they got you guys. And being able to have that option, because we didn't have that option to go to a family member. Nobody took us. And that was scary. When you have a huge family and nobody wants to take the responsibility because they feel like it's going to be too much, or they don't want to deal with your parent. Mm-hmm. How do you think that makes the children or the child feel? Not wanted. How are we supposed to act when we know that? How are we supposed to look at the family members? Some people, I can't even, when I look at them today, and I'm 40, I'm like, when I was 11, you just said whatever, so just thinking about this, and it stays with you. So I don't mean to take over, but I'm just so passionate about this, because I want people to know this real life experience.
Yeah.
And
And
Dr. Russell, if I could just share
Yes.
one experience that I had with the little one. So obviously with the older kids, absolutely. What Dr. Daniel, what you're saying has absolutely been my experience as well. What breaks my heart are the little ones. They can't even verbalize what the trauma is that they've been through, and they can't even remember why they are scared. Mm-hmm. And that's so much about the lives of the kids that I've known breaks my heart, but that part to me is the hardest for me to wrap my head around, because the older kids have a chance to write it out or to talk about it or possibly even move past it, but it's those littles who've been through it and can't even remember it, but have it it's almost in their bones. And I had a little one in my home who came to me at 3, and I was her 3rd foster mom, and her 2nd foster mom, who'd also been her 1st foster mom, but had moved away from her to a 2nd foster mom, and then had come back into care. And so she came back to her 1st foster mom. Her 1st foster mom, who was her 2nd, didn't explain to her why she was being disrupted and coming to me. And she came to me without understanding what was going on. She kept asking, well, when is Mama so-and-so coming to get me? And I was having to explain to her, well, you're gonna be with me now. And just the damage that does to someone. She was 3, and she is so smart. And she, on the one hand, she was so smart. She already knew her letters. She already knew so much, and I knew that there's parts of this that she was gonna remember, and there was parts of this that she was never gonna understand. And watching her interactions with her mother, and just thinking about the damage that all that dysfunction was doing to her. It just was, I was just like, there's just the chance of healthy attachment here is just so remote, you know? And it's heartbreaking because they're so little and there's no way to really explain to them. All you can do is just love on them and hope that gets through.
Yeah.
It's just, that's the part that just breaks my heart.
I have a question. So in the instances where children are reunited with their families, and if they've had trauma, especially different ages, what happens once they go back home? It's not like the trauma goes away. That's my question. Like, what's next? Like, if we were to foster our nieces and nephews for however long, knowing that, even for our perspective, we want to see them back with their parents, but their parents need to deal with some stuff, and they go back home, knowing that the trauma was created by the parents. Like, what happens? Do you stay involved? Do you just, what happens?
I think every situation is different. When we were in kinship care, because we ended up going there after an unfortunate situation in a foster home, but my mother had access to us, and sometimes it was damaging, while other times I still wanted to see my mother, but nothing changed. I mean, once they're given back, I mean, there's some type of supervision that happens. I know for some homes where workers and stuff still, you know, come out, but we were never we weren't reunified with our mother. Her rights were terminated. And so the back and forth though was traumatic. And I think a lot of times on the outside looking in, we look at people's families as dysfunctional, but for them that's normalized behavior. So
Right.
how they raise their kids, how they do things, how they approach their trauma, even if they don't acknowledge it, and you know, you can see it. So, and it's like, who are you to tell me how to raise my kids? These are my kids, you know, so they feel like it's a threat, like you're coming in to disrupt or take something. So from my experience, if you have a conversation with a parent and they don't feel like that, then it's better to work with them and not make them feel like the way that they're doing things is wrong, but there are alternative ways of doing things.
I'm
So
more
just
concerned
that.
about like the aspect of the kids. So like in
Yeah.
our situation, you know, we've been asked by the attorney for the children if we were willing to take them.
Yeah.
For a lot of reasons.
Yeah.
One, we live very close. Two, we're very close. My brother and his wife are going through a horrific divorce, and I mean horrific.
Yeah.
But their kids are 2, 5, 11, and 13. They've all been very traumatized by the things that have gone on in the last 3 years. They are all in very different places. They are all acting out in very different ways, and the kids have always felt very safe around us. I myself am a trauma counselor.
Yeah.
So I've got a lot of experience with that. Just have kids because I was always allergic till now.
That's a good one. That's a good one.
Luckily, we both have that same allergy.
Yeah,
And in all the investigation, you know, they asked if we would be willing to take the kids. So we, you know, because there are no other children in our home, we've always provided a safe space for them to talk about what they're feeling or what they're going through, other than, like I said, the baby. But it looks like they're going to be removed. So we're just trying to get prepared, but my thought is, even talking to the attorney for child, as you said, the goal is to be able to give their parents, give them back to their parents and let them work out visitation XYZ.
Yeah.
And, you know, from my perspective, I'm like, how do you take a kid out of that situation and then just put them right back?
Do you remember what she said, what her brother said to her?
Yeah.
I just wanted to be with mom and dad, right? So when you think of that from the child perspective, then you shift your thoughts about what that child might need. And remember the resiliency, and remember the experiences that they're having with you are gonna lay the foundation of how things should be. And God hoping that they're in good counseling, that includes those parents, right? You know, if there's any work to be done from that family system, if reunification is gonna occur, that hopefully it's happening in a way that's gonna promote safety and well-being for all. My advice to you as a trauma therapist, because they would give me the most difficult children thinking that I'm a trauma therapist, you
No,
can handle this
exactly.
one. Please take care of yourself, practice self-care, don't be a therapist at home. The kids will ask you to be. My foster, now adopted children expected me to be that same therapist to them that I was in my office, and when you're a parent, you can't do that, right? And you don't expect that from her either.
No, he's really good about it. He's really good.
Good.
I have to say.
Yeah, just take care of, you're doing it every day, and then you're gonna go home and try to do it as a mother and a parent to these nieces and nephews.
Well, that was our conversation, is that we would not forget that we were aunt and uncle first, even before foster parent, that we were aunt and uncle.
Good.
And that we would wanna maintain that relationship and let them know that our house has always been their home, as a space that they all are very attached to and feel good with. But, you know, they're watching their parents really have a battle that is like unbelievable. And, you know, for example, like my niece, you know, she never got into a single fight, never got a bad grade, never been suspended. Since divorce happened, she's been expelled from school. I mean, and my nephew, the same, going to private school, kicked out. The little kids, it's really bad. It's really, really bad, and it honestly can't happen fast enough so they can just deal with their stuff. But in literally the 6 months that have gone by since the divorce started, these are different kids.
Well, divorces are like 24 months now because of COVID, they're taking forever.
Oh, it's sickening to watch, it's heartbreaking to sit back and watch these kids literally be traumatized the way that they are. They don't feel safe, they are not safe, and we're, you know, just doing, this is why we're taking this class, and I wanna know about other classes. Because we've lived a childless life. Well, I got 15 nieces and nephews. Let me take that back. Our life has not been childless. It has been overrun by munchkins, but like, it's been nice because we both own businesses. We both have our own private businesses. And you know, a business can be a child. It takes a lot of time, a lot of effort, a lot of sacrifice, and that was, we're older. We just decided we were older when we got married. We were like, yeah, we're good. And then, you know, but what we've done is poured every minute of love we can into all of our nieces and nephews to just not miss out on the experience of loving children. You know, which is probably how we ended up part of being who was selected for this whole project. But we've been doing everything we can to prepare our minds, our hearts, our homes, and yet it's so unpredictable, even just the timing and everything else. So we're trying to look ahead, like, okay, say this manifests, but then what next? What next? You know, it's literally, I doubt this will ever be okay, especially for the older kids. You know, the damage is, to see that they could almost shatter the way that they have.
But just like Maggie said, providing that safe space for them. My mother's older sister provided that for me when I was younger, before we were even put into foster care. And she was the one, I knew her phone number, I knew to call her, I knew her, she's taught me how to speak like an adult at the 18 months. She said because of where my mother was leaving me, that she wanted to make sure that I was safe and that I could communicate. And so I never forgot that. She's always been there. And so when anything goes down or anything happens, I call her and I let her know. So we can't prevent trauma. You know, we can't prevent things from happening. All we can do is give them the toolkit that they can utilize in order to deal with it the best way that they can. And I'm just thinking they need that break to come over to your house.
That's exactly what we said.
They need that break, and who knows what will manifest from that, and who knows, you can teach them some things of how when something, and have conversations with them. I used to hold my breath. I didn't know that when my mom was in abusive situations, that in order for me to tune it out, and I would hold my breath. I didn't realize that until I was an adult. And my eye watch was saying, you're not breathing, you know? And then when was in therapy, you know, how does trauma manifest in your body? Holding your breath, your body is tightening up. So these are things that my aunt didn't know about that, but just thinking about that and how it manifests, but you have the tools to teach them. You know, you can't change who their parents are or what they're going to do, but just you can prepare them for if they do go back into that situation, to have some type of toolkit in order to deal with it. And it sucks that they're young and have to deal with that, but a lot of young people have to deal with horrific things. But they're blessed to be able to have a safe space with you all, and maybe this will change their template of the world, and know that every family isn't like their parents, and everybody isn't, doesn't have to deal with that. And just to help them to know that they have that safe space, because a lot of youth do not have a safe space.
And keep in mind that attachments can form at any age. We
That's
talked
why-
about.
That's why I asked you that the other day.
Right, we talked about the critical period where, there's a natural process where babies form a secure attachment with their caregiver, but those attachments can still form later in life. They can take a different course sometimes. And kids can have more than one secure attachment. So if kids go into a certain home and develop a secure attachment and then go back to a different place, that attachment, the attachment that's already there, doesn't have to change. And they can still form that secure attachment with somebody else, provided, of course, that, there's been, if it's a home they were removed from, that there's been some changes from the parents' perspective and they followed their menu, or they've worked through, things in therapy themselves, and the environment is conducive to forming a secure attachment. That can happen later, even if there was previous damage done before. It makes it tricky, it makes it more challenging, but it can happen. So, to Leah's point, if nothing else, those kids will have the opportunity to form new secure attachments, which will still be helpful to them, even as they try to traverse what's going on outside of your home.
But we're kind of fortunate in that respect, because my wife is very good at, from fetus on, she is in there with the babies, loving them, and forming what seems to be from the outside a very secure attachment with all of them. I'm more the, you're 2 or 3 or 4 years old, I'm the fun uncle now. That's my role in the thing, but it
Well,
works, and I think they do have good connections with us.
Yeah, but secure attachments can look like lots of different things. It's not necessarily about a specific approach. It's, is this caregiver consistent, predictable? Do I feel the love and support from them? Do they make me feel safe? That can look like, the nurturing caregiver. It can look like the fun uncle. It can look like a lot of different things. And again, that's the good thing about attachments. They form in lots of different ways. And it comes down to just maintaining the consistency and showing, being able to show your support for the child, and for the child to kind of also see that there are people that can, I'm gonna say, kind of ride the wave with them when they have their big emotions. My daughter is 2. We've hit that point in the 2s probably about 3-4 weeks ago, where we're getting some big feelings.
I'm with you.
It's been, and 2, I forgot who said it before, but like, I think Maggie, it was you, it was like taking your own clinical experience and bringing it into your homeroom, you just throw it out the window. I cannot convince my daughter that we need to get dressed at some point today. I cannot convince her you need to get out of the bath right now because it's time to get ready for bed. But what we can do is sit with her big feelings, and they're big. They are big. But similarly, like kids in these situations, they have big feelings. And they have not, there's a fear of them, but when they see that other people around them aren't afraid of them, they learn that they don't have to be afraid of them. So, and again, that can come from approaching kids in many different ways. But that's a big part of how kids develop secure attachments. They see that, all right, these people, they're not changing anything just because I'm throwing a tantrum right now. They're still there, they're still talking the same way they did before the tantrum. They're, they may not be giving me what I want, but they weren't giving me that 20 minutes ago, so it's the same thing. And that helps them learn that like these feelings are okay. It's okay to feel them, and then they figure out how to regulate them as they get older.
Is there, a lot of work that goes into, especially, now that it, seems evident, I know one of the things I tend to work on with kids when I work with kids, because I work with kids, not little, I work with 7 and up, but, you know, emotional intelligence and really digging into that. I haven't heard much about that at all in these meetings.
Say more about what you mean by emotional intelligence.
So emotional intelligence, you know, it's saying that, you know, that their feelings are okay, but actually helping them to understand that their feelings have a purpose.
Mm-hmm.
And that their feelings are part of literally being a human.
Mhm.
That their feelings are not meant to be, it depends on the age of the person that I'm working with, honestly, the way that I
Mhm.
explained it, but, you know, that your feelings are literally your own self, communicating with yourself about your experience, and that it's meant to be, well, as you said, you had your son, your brother,
Mhm.
you know, sit down and write down, why am I doing that? What was I feeling? Why was I feeling that?
Mhm.
Start to understand that feeling so that you can have a healthy relationship, even with what you think is a negative feeling. And I find that with the kids that I work with, when they get that, they really do a whole lot better,
Mhm.
a whole lot faster. But I really haven't heard, not in just this setting, but other settings, I really haven't heard anyone talking about emotional intelligence when it comes to these kids, and that's exactly a big piece of what they need.
Yeah. You want to say something?
I just know that schools are saying they're doing social emotional
Look at-
development. And sorry to Josh, not Josh, Joel, who's not here to really defend what the schools are or aren't doing. You know, I do a lot with Inside Out in that movie, and do a lot with zones of
Yes.
regulation, just to help children understand that. And I agree with you. I mean, I always help the parent. I mean, some kids come very emotionally intelligent, right? And sometimes because they experience that trauma and they're highly sensitive to how people feel about them and how they feel towards others. I agree with you. I mean, it's a big part of what I do because it's not being done as far as I
Right.
can see
Me too.
anywhere else.
Yeah, so I just wanted to say, I'm working on that right now. Are you familiar with the Myers-Briggs?
Mm-hmm. Yep.
So with older people, when I do it with them, they say, oh my goodness, if I had learned these things about myself years ago, I would be on a totally different path.
Do you know what the
So-
Myers-Briggs is?
Yes.
Everyone? Okay.
So I've been doing that with the young adults, so teenagers and up, just to think about who they are and not have anybody else to write the narrative for them. I know that when I was growing up, I was told who I was going to be. I was told how to feel. And if I felt anything different, it was like shame. And you shouldn't feel that way. You shouldn't do that. And so when you have that narrative growing up, you don't know what to believe, you know? So I just think a lot of youth who are in foster care, they really haven't understood who they are yet, and nobody has taken the time to really explain that to them. And I'll just say one more thing pertaining to that. At the age of 15, I talk about that age for me because it was a catalyst that happened for me at that time. I literally, hate is a strong word, but I hated being in the foster care system. It just was a really rough and hard time for me. And I felt like I was not being heard. Nobody understood. The home I was in was absolutely horrible. And it was just really bad. And I said, you know, when I turn 18, I'm out of here. This is it. And then I met this woman one day. She, you know, for the agency, she was the CEO, and she came to visit in Buffalo. And I just happened to be at the agency this one day waiting for my social worker. And she said, you got it. And I'm like, she is crazy. What is it? What is she talking about? Why does she keep saying that when she walking past me? And she said, you have that it factor. And I didn't know what she meant at that time. And I'll say her name is Washington. She took her time with me. She was used to working with youth who she saw something in them that they didn't see within themselves. And she became my mentor from that point on. And so growing up, different things that were happening, she didn't say, oh, you're stupid, you're dumb, you shouldn't have done that, you know, things like that. She said, okay, well, do you feel like you're past this situation? If not, I'll go through it with you. But if you are, what did you learn from this situation? You know, and so I needed to have conversations like that, because within my family, they would say, girl, you too smart. Why are you going through that? That's dumb. Well, I don't have the life skills. Being smart in school and having life skills is two totally different things, you know? If no one has taught you the basic, what the basic necessities are, or having that foundation, you don't know. And so just thinking about that, and then the work that I do, and a lot of times the young adults will say, well, Miss Leah, I didn't want to say nothing because I don't want to sound stupid. And I said, there's nothing stupid about it. Even finding the proper undergarments, or knowing where to go in the community for different supports. If no one has taught them, you don't know what you don't know. So I just say, thinking about those different things when you were talking about, you know, learning the emotional competencies and all those different things, sometimes they just weren't allowed to have that space. And so when you provide that space for them, they flourish because they know that it's okay. And I used to have a business called Words Have Wings, Healing Through Writing, and I would let them write all types of stuff, and I would learn all types of stuff about these youth. And the people would say, like the social workers and everybody, they open up to you so much. How do you get I said, I just let them be who they are. You know, and then they become comfortable, and then based on what they share, I give them resources and different things to help them move forward to do the things that they want to do. You know, and so to me, it's just that simple because it happened for me. But I tell them, you have to do the work too. But again, if you don't know who you are, and so many people have spoken for you all your life, you know, how are you supposed to move forward? How will you know anything, you know, about yourself except what the world has told you? So having those different things, having those opportunities have been very helpful.
Now, one of the things I've seen that, you know, is a pretty common part of therapy for kids along the lines of emotional intelligence is teaching emotional vocabulary.
Right, right, that's why I work with 7 and older.
Right, but you know, therapists will work on emotional vocabulary even younger than that. You know, if kids can't put their feelings into words, that again adds to the scariness of them because they can't describe their experience. So, and teaching emotional vocabulary can come about in a number of different ways. You know, it can come from specific exercises or games that purposefully I shouldn't say force, but part of the objective is for kids to name feelings. It comes up in having kids write out things, draw things. And with younger kids, it's often a more indirect approach through play therapy, where therapists will just name what they're seeing, which is something that, you know, caregivers can do in their homes. If you see a behavior, just say what it is. It looks like you're feeling this. And you can pose it as a question, you can frame it as a statement. And it's okay if people are wrong with their guesses, so to speak, because, you know, unless we're inside the body and mind of that child, we don't know for sure what the emotion is. But by posing the question, it makes the child stop and think a little bit, and they can internalize what was said and like, okay, so that's what I call this. Or they'll say, no, that doesn't sound right. That's not what I'm feeling. What are you feeling? I don't know. Okay, but it's not that. That's still useful information for a child. So that kind of just consistent conversation, and the exercises can happen in different ways that helps them put feelings into words, and that's what leads to the communication, so that they can start kind of taking the lead and expressing what they're feeling, and saying, I feel this, this makes me feel that. And I would say across most therapy methods with kids, there are ways to put that for that to fit in as part of the therapy, whether it's direct or indirect.
So that was my question.
Any other questions or thoughts?
I have a question regarding housing. I guess I'm wondering for someone who is in need of assistive housing, like to help them manage life, but also has felony convictions. So what are the opportunities or barriers out there? What is available for someone with that need?
Someone with like a disability?
Or she said felony.
Felony convictions, there's mental health issues, trauma past, just someone who doesn't have a lot of ability to manage life well on their own, needs help, but is having trouble finding housing and has been in and out of homeless shelters, so.
So I think that I'm not as up to date on housing law either, not that useful tonight it turns out, but I think that it is disqualifying for section 8 housing, but
It
I think
is.
if you were able to access it through, if the individual, was able to access it through the Office of Mental Health, I'm not sure that the felony convictions would matter. And
I'm being
only-
told they do, so, but I don't know, that's what I'm trying to,
They
you know,
do,
find
but
out.
there's reentry programs.
Mhm.
A lot of churches, I can send either to you, there was just some people in the community talking about this where they take young men, it was a pastor, I think his name was Pastor Walker.
Yes,
And he
from
was,
back to basics.
yeah, and he, and him and Pastor Giles,
Yeah.
and I think they have some specific housing for them.
Yeah, and they're at the Erie County Holding Center at the Service Link stop. Every day there are people there to help anyone who's re-entering into society manage housing, mental health. There are caseworkers there every day at the Service Link stop, bottom line on Eagle, to help with that problem.
And Best Self, they have some new programming.
And their best help is there.
Yeah.
Best help is at Service Link stop.
I was gonna say also, they also help with employment as well, with the housing
Yeah,
also.
they do all of
and
the
it's-
stuff,
It's
yep.
usually all over social media as well, with the days and times that they're available or around. So there's definitely a few connections or people who you can speak with who can get you in the right door.
Okay, thank you. So, you said self-stop?
Service Link stop, it's at the
Service
Erie
Link.
County Holding Center on the side door entrance, so it's really, as soon as they leave, the holding center, they can go right there for services.
Okay, thank you.
Any other questions, comments, thoughts?
I have a question for you guys.
Right.
So there's a big trend at the moment to make schools one-stop shops. Putting true psychiatric care, sometimes psychological care, sometimes therapy into the school setting is sort of, I think, kind of like maybe the biggest version of it. But then there's also things like having restorative circles to start the day, done by a teacher who is not trained in mental health.
Right.
And I will say, the last 2 weeks, I have gotten calls for suspensions because kids said things that you should not say in a school setting, but also they said in a circle. That was supposed to be safe.
Absolutely.
And I just wonder, sort of on the big version of it, like what does that do to a kid's day? Is this the right way to providing this? And then if you are a foster parent, like, should you have a conversation with the school about, like, maybe this kid shouldn't participate in a circle?
It's such a great point, and one of my biggest contentions is when I have even students in the school saying, we're doing trauma therapy in school, and then you expect the child to go back and learn math.
Yeah.
And we really elevated that nervous system, we elevated their sense of self, we elevated so much, right? And like we say, their whole body lights up. And they're raw from emotion of what it, so I'm not for that one-stop shop, I really and I'm not for therapy in schools, I'm not. And I think the research shows it. I think you're managing behaviors and maybe doing some of that emotional intelligence and psychoeducation, which is healthy, but I don't think it's a place to really, and a lot of parents do it because it's convenient. A lot of parents want their child to go to the school counselor. Best Self's pushing into schools, Gateway's pushing into schools.
Yep.
And so many parents see the convenience of that, but ethically, as a clinician, there's no way I'd go into a school and do that deep dive.
I absolutely agree with that. I did have a slightly different perspective on the circle. I think that if a teacher is circle trained and is prepared to deal with what they're bringing up, but I definitely don't think it should be first thing in the morning, and I don't think it should be done by someone who's not circle trained.
And
Like,
it
I
should
think-
never be violated.
Yes, it should never be violated, it should not be something that gets them referred to the principal, like I have lots of feelings about all of what you just said. But I am somebody who's trained in restorative practices, and I think there's a lot of really beneficial things about restorative practices that can be brought into the school setting, but it has to be done advisedly, has to be done really thoughtfully, planfully, carefully, respectfully. And it shouldn't just be like, okay, everybody in homeroom, we're gonna extend homeroom by half an hour, we're gonna talk about what happened on Saturday. With teachers who are not prepared to deal with the emotions and not at homeroom when kids have to carry all those feelings and thoughts for the rest of the day, like you were saying, Maggie. There's just lots there that's not gonna go well.
I agree with what you both said, and I think it needs to be a professional from the outside coming in, because what if the students have an issue with the teacher, and then the teacher carries bias, you know, that
That's
unconscious
true.
bias with whatever the student's saying. Now she's looking at the student sideways.
And teachers don't have the same
Right.
confidentiality
Right.
and ethical guidelines as we as practitioners do.
Right.
So they are freely sharing information.
Right, and then again, opening up that door for counseling, and then not being able to close it to have a professional there. And I think, you know, from my experience with the school counselors, they haven't, I'm not a happy camper with them this year.
No.
You know what I mean?
Yeah, me either.
And even with my own child
Taking
and
it
how
too
things
far.
are in the school, like even with the incident that happened here in the city of Buffalo, you know, nothing for the kids, and they're breaking down, and half the teachers didn't come to school that Monday, and then again, what do you have? And they're suspending kids for wearing Crocs to school, or just different silly stuff, you know, that I hear. But something definitely needs to be done, and they know that we as adults suffer from this stuff. So imagine what it's doing to the children, and then what they're thinking about, and then amongst their peers, they're talking amongst their peers, and they're formulating their own things and thoughts. So I think it's very important. And even if they maybe have like a little mobile like bus that comes after school, or some type of after school program, I mean, I think that would be
That would be
good.
fine.
Cause
Yeah.
if the
Just don't
parents,
send them to math class.
Right.
Linkages, like
Huh?
linkages, where they
Right.
can get linked up to,
Right.
but not like get taken out of third period,
Right.
discuss your deepest, darkest pain, and then go into fourth period and be ready to study English again.
right,
That's
and we're
just
like,
too
what's wrong
much.
with you?
Yeah. Why don't
What do
make
you
it better?
mean?
Yeah, exactly.
You did this to me.
Yeah,
Right,
it's too
right,
much.
right,
And then they call CPS because they said this.
Yeah,
yeah,
yeah.
yeah.
From a psychiatry standpoint, now I'm not directly involved in this, but I know there has been kind of a push to try to get more consultative services in from psychiatrists. And there's a couple of districts that have programs. Buffalo Public Schools is working on a program with some psychiatric consultation, and then some of the more specialized programs, like, you know, the RISE program has some psychiatric linkages. You know, the day treatment program that the Children's Psychiatric Center runs has a psychiatrist embedded in it. And my understanding of those spaces is, you know, when there is psychiatric involvement, there's kind of two purposes. One is as consultations for the child's primary provider, so there might be some recommendations that go back to the pediatrician. Sometimes there can be some, you know, observations that are then passed along to the school team about, again, you know, helping to maybe give a little boost about trauma-informed care and how to, you know, work with a certain kid who's displaying certain mental health difficulties. And a lot of that is, you know, the consultative model with psychiatry is necessary because there's just not enough psychiatrists to do that as it is. So the services are stretched. So there's a limit to it, but there has been a push in recent years to get more of that into the school. I agree with, you know, a lot of what was said, especially about, I think this, what you all brought up, it brings up kind of an issue of boundaries in schools. You know, there is a certain, school counselors provide a certain value in a certain area, and that's to help kids navigate school stress and, you know, interpersonal relationships that come up within school, you know, maybe helping kids foster some social connections, and certainly referring out to further services if they're needed. You know, I've certainly, in my work, have gotten referrals from school counselors for kids to have psychiatric treatment with me, but it's because I think part of the challenge is making sure everybody knows when something has gone beyond the level of care that they're meant to provide, right? Which includes, you know, that goes all the way up and down the ladder. So, you know, if a school social worker is seeing perhaps a lot of trauma-influenced behaviors in school, then they can be a resource to refer that child to an outside trauma therapist if they don't have one, or to make sure that, like, support services in the home can be there, but they're not meant to be the trauma therapist, right? That's not their role. And I think similarly to most areas of the mental health profession, there can be a big variety with kind of how folks in those settings understand kind of their role when things are going beyond their role. It's a conversation I have a lot with pediatricians because I do some consultative work with them, because they see now more mental health cases than psychiatrists do, because there's just, again, not enough psychiatrists. But the idea is, you know, with teaching them is like, when is this something that is within the realm of a pediatrician to address, and when is it not? So that's something that I think the system needs to keep improving on. Because I don't think folks, when they go into a particular line of work in mental health, often are taught that boundary. Like when you've been stretched to your limits and it needs to move on to a different space.
So for social workers, it is in our code of ethics that you only practice within your scope of practice. Licensed mental health counseling, not so much, but I still think because there's such a shortage that agencies are stretching new clinicians beyond their abilities.
And that's happening, I think that's happening across the board in mental health. There's a shortage at all levels, and folks are trying to do what they can to help as many kids and families, and that can lead to kind of like stretching your boundaries, and we have to be careful about that.
Absolutely.
So any other last thoughts or questions before we wrap up today?
Just, like I said, we were interested in other trainings, if there are any, if anybody knows of any. You know, this is more for us to just sort of prepare.
I'll have to look into that and see if there's any coming up. I mean, we've been trying to run this particular series yearly, so we will do this again next year, hopefully. And actually, to that point, if anybody has any feedback about positives and negatives about how this series was run, I would love to hear that. This came because of feedback, so this doing it this way this year instead of doing a fourth lecture, so any feedback is welcome. I'll look and see if there's any other trainings or programs coming up that kind of fit. Thank you.
And thank you each for doing what you're doing.
Absolutely.
We need more.
And thanks to everyone on the panel today. I mean, I think this was a great discussion. Your expertise is so valued, and just thank you for all the work you're doing with, you know, a group of kids and families that really, really need it.
Well, thank you.
Yeah, thank you all very much for spending the evening with us tonight.
Thank you.